present For the Record.
Welcome to For the Record. I'm Naomi Holtz. COVID cases continue to rise to levels we have not seen in Wisconsin since January. Friday morning, just 8% of the ICU beds across Wisconsin were open. Here in South Central Wisconsin, it's just 9%, or 24 beds, and that's according to the Wisconsin Hospital Association's COVID tracker. Today, I'm joined by Dr. Jeff Pothof, UW's Chief Quality Officer, to talk about this. Dr. Pothof, thanks so much for joining me today.
Good morning, Naomi.
Before we get into our interview, what's your off-the-cuff reaction to the numbers I just cited?
You know, I worry about these numbers. Some people may think that 8 or 9% of ICU beds being available is still a healthy number of beds available, but it's not. Oftentimes these averages are, over the course of a given day, there is 8% of ICU bed capacity available. But that might mean that for some parts of the day, there's much less than that. ICUs are fluid. People are coming and going all the time. But that does mean that there are likely physicians around the state looking to get an ICU bed for their patient who are not immediately able to get that without waiting for someone else to be discharged or stepped down.
Now, our News 3 team visited the UW's COVID ICU ward it was just about over 2 weeks ago, and you told us at the time the biggest concern wasn't so much beds, it was staff. So what's the situation on the ground today inside COVID ICU wards?
Yeah, it's not much different than when you were there before. We continue to see that elevated number of COVID ICU patients, but also a large number of other patients who have other healthcare needs, whether it be stroke or heart attack, or maybe they're septic, and it's making their ICUs very full. Now, we're able to utilize all of our ICU beds, but you make a good point that staffing is thin and staff are getting burned out. We've been at this for too long, and those two things together, create not the best picture right now as we're getting through this Delta surge.
Absolutely. Now, what's the demographic of the people who are in these beds? Who's sickest? Are they older, younger? Are they vaccinated or unvaccinated?
Yeah, when you look at COVID patients who end up in the ICU, the vast majority of them are unvaccinated. Oftentimes they might have some comorbid conditions that does predispose them to more severe disease. But every once in a while, there's that person that has no business being in an ICU, but just got sick with COVID, and there they are. For those cases where we see vaccinated people in the ICUs, it happens on occasion, but usually in folks with multiple comorbidities. They're typically elderly, and oftentimes they have a very compromised immune system. So it's pretty unlikely that someone who is in a pretty good state of health, who's vaccinated, would end up in an ICU. It's just something we don't see.
Now, you kind of referenced this a moment ago. There's been reports around the country of people dying while waiting for non-COVID emergency care. So what about here? Are you aware of any cases here where hospitals are triaging emergency care?
Not so much triaging emergency care. I think, we are certainly full, we're busy, but we're able to meet those healthcare needs. I think sometimes there are, slight delays in getting things going, but not like you hear about in other parts of the country where it's taking them, hours and 20, 40 phone calls to find a place that sometimes is more than a state away to place someone who has critical care needs. That's not the situation here in Wisconsin at this point.
Do you worry, though, that we're going to get there?
I can't cross off the possibility that it could happen. Delta's still around. We're still seeing a lot of cases of Delta, and there's just a lot of other healthcare needs, and our ICU resources in the state are finite. It is really hard to create really effective extra ICU beds, whether it's the technology that's in those rooms or the skill set that the people that work in that environment bring. It is the most difficult level of healthcare to expand on.
Now, I think you'd agree with me. It's a little bit discouraging we're still having this conversation. Back in January, we thought we were seeing the light at the end of the tunnel, beginning of this year. How often do you think about that now, the conversations you were having with media when the vaccine first was rolled out?
Yeah, we thought we had this beat. And, back then, the science, the data supported that. We had, no Delta variant. We had coronavirus that was, very susceptible to our vaccines. We weren't seeing a lot of people who were vaccinated get sick at all. Numbers had come down tremendously. It looked like all we had to do was get vaccinated and we were good to go. And then I think there's two things that happened. One, Delta variant came around, and it is much more contagious. But two, people didn't want the vaccines, and there's enough people who aren't vaccinated where we can't put the fire extinguisher on this fire that is Delta variant.
All right, Dr. Pothof, always good to talk to you.
Thank you.
When we come back, the state's chief medical officer joins me to talk about another worrying trend, COVID spreading in our schools.
You protected our rights, preserved our freedom. You may have even risked your life for us. Now, it's our turn to fight for you. Your local Wisconsin emergency, energy, and housing assistance providers, and the Keep Wisconsin Warm Cool Fund reward the service of our veterans with rental and energy support in their time of crisis. Apply today to get the fresh start you've earned.
Denny's now has Bennies. Not just one, but many. It's the classic Benedict's plus 2 twists, so we really must insist that you try 1, 2, or all 3 of our Bennies. See you at Denny's.
We're here at the local farmers market where Informed Choice Insurance Agency is offering fresh, local, hand-picked Medicare. What do you mean when you say shop local for Medicare?
Your local Medicare plans have all the bells and whistles that national TV ads promise, only better, because you're working with local agents who know the doctors, the specialists, and the hospital networks inside and out. You're not going to get that calling a call center in Des Moines, Iowa.
Don't get fooled by national TV hype. When it comes to Medicare options, keep it local with Informed Choice Insurance Agency, and they're free.
Is your credit score getting in the way of the things you want to do? Personal loans through NetCredit offer fast and flexible lending. Borrow up to $10,000 and choose repayment terms that work for you. You may even be able to build your credit history as you repay. NetCredit, a more personal loan.
Madison Magazine's Fall Restaurant Week 2021 is here. Participating restaurants will provide a 3-course lunch starting at $15 and a 3-course dinner starting at $25, featuring wine and more. Don't miss Madison Magazine's Fall Restaurant Week 2021, starting September 19th through the 24th. For participating restaurant menus and details, visit MadisonRestaurantWeek.com. Presenting sponsor, the Keep Wisconsin Warm Cool Fund. Supporting sponsor, E&J Gallo Winery.
For the record, our team has been tracking COVID cases in schools throughout south central Wisconsin this week, with hundreds now quarantining after testing positive or being in close contact with someone who did. The big question over the next few weeks, at what point is it a reflection of community spread or school spread? Joining me to break this down is the state's Chief Medical Officer, Dr. Ryan Westergaard. Doctor, thank you so much for joining me today.
I'm happy to be here. Thanks for the invitation.
So let's start right there. What needs to be present in an outbreak investigation for the state to determine, or public officials to determine, whether it's school spread or community spread?
Well, our goal in public health, as it has been throughout the epidemic, is for every time we hear about a case at the local level, we do an investigation. And the investigation addresses who has the person who tested positive been in contact with during their infectious period. So they're either a couple days before the onset of symptoms or before the test came back. So through those interviews, and those interviews are done in a pretty standardized way in all of our jurisdictions, we can get some insight into whether people were exposed to someone who was known to be positive for COVID-19 in a school setting, or if it was someone in their home or other community. So we really use boots on the ground epidemiology to try to sort that out whenever we can.
Now, we're 3 weeks into the school year for most districts. So what do we know so far about how it's spreading and really where it's spreading?
Well, the news is bad, unfortunately. When you look at our state map, county by county or district by district, we're really experiencing high levels of spread of the virus everywhere that we look. So it is transmitting quickly in communities. In these communities, there's people who go to school and go to work. We don't always know whether transmission occurs in a school or in an extracurricular setting. I think the message for people is that transmission is high everywhere. People, particularly younger people, can transmit the virus if they are not having symptoms. And so that's why testing and contact tracing and really trying to be aware of how we put each other in exposure to people who might be infectious is so important. What we've heard about so far is that there's been a large number of cases in schools. We have open school-wide investigations that we're helping with at the state health department, and we've also seen some outbreaks related to sports. So our message to all schools is to use all the prevention strategies that we know work. That includes masks and testing, staying home when you're sick, watching the size of gatherings, and cooperating with local public health, who has really the best knowledge of our local strategy and recommendations on how to keep each other safe.
Now, with the Delta variant, what do we know right now, the body of evidence when it comes to COVID, when it comes to the Delta variant, about the danger to school-aged children?
It's a good question. The Delta variant, which is now everywhere, essentially all COVID-19 being spread in Wisconsin and the country is the Delta variant. And again, the Delta variant is different because it's much more infectious. It spreads more easily from person to person. So that means that at any given level of exposure, the risk is higher to everyone, children, adults, elderly. The risk for anyone becoming infected if they're exposed to someone is higher than it was a year ago because of the changes with the Delta variant. Now, does that mean that the people are likely to get more severely ill, or is the virus itself more dangerous if it's the Delta variant? We don't really know. But when we have a virus that's much more infectious, unless we really are diligent in preventing the spread, we're going to see a lot more cases. And that's unfortunately what we're seeing. So all age groups, all people, when we have a generalized epidemic of this highly infectious variant, are at higher risk of getting infected. And in that setting, we're going to see a lot more severe cases because some certain percentage of cases, even among children, can be severe and sometimes fatal.
Now, as a doctor, I know you're not going to want to speculate, but what do we know about what we can expect from school districts who have lower versus higher levels of layers of protections?
Well, the science is pretty clear, and there's some Wisconsin school districts participated in some of the science last year that we know that school environments can be kept safe for in-person instruction when everyone wears a face covering. So teachers, staff, visitors, if everyone is wearing a face covering that covers their nose and their mouth at all time when they're indoors, we know from experience that that can keep transmission in school settings very low. Science is pretty clear on that. We also know that the flip side of that, we've seen among young people in schools, in sports, and more recently a really troubling study in California about a teacher who took her mask off to teach and infected 50% of her classroom. We know that when people aren't wearing masks, and particularly among people who aren't vaccinated, like younger children under 12, we know that the virus can spread rapidly and can infect many, many people. So what we expect to see, and I think what we're starting to see, is that in environments where we don't use all those layers, where we don't use mask wearing and we don't do quarantine and isolation, we'll see more cases. And that's really what we want to try to all work together to prevent. Some school districts have made masks optional. Our strong recommendation here at the state health department, from the local health departments, and from CDC at the federal level are all consistent. We think the best idea, the safest way to keep children and communities safe is to have universal mask wearing in school settings. And we really, if there's districts that have not made that decision yet, there's still time they can and should change that policy.
All right, Dr. Westergaard, thank you so much for taking a few minutes out of a very busy week.
Thanks for having me. Bye-bye.
Tonight on News 3 Now at 10, join me for a special report breaking down what we know about COVID in schools right now and recap these For the Record conversations online at channel3000.com. Thanks for joining me. Have a safe and healthy week.
This has been For the Record.